Hello everyone, in this video we are going to talk about the urination. As you can see from the translation in your textbook, it translates as bladder movement. It actually refers to the urination. So in this session, we are going to talk about urination includes the volume, the frequency, and the feelings during urination. So in order to talk about this session, we need to understand, we need to study the healthy situation, physiological condition of a healthy person. A healthy adult, we will have about 1,000 to 2,000 milliliter urine per day, and it will take about 3 to 5 times urination during the day and at night. At night, here it refers to, it actually means that's while you are sleeping. So it doesn't mean in the evening. It refers to when you are sleeping. So if the patient tell you while you are sleeping you only have once maximum, or you don't have to get up to the toilet at night. So if a patient tell you that they need to get up twice or even 3 times during their sleep at night, then you will know that this is an abnormal situation. The frequency and the volume of the urine also will be affected by the temperature, including the body temperature and the temperature of the environment, which is related to the weather, the water consumption, sweating, as well as the age of the person. So these can affect the volume and the frequency. When we talk about urine, we need to think about the theory. Also, we need to see from the physically, urine is the body fluid from the body and to the externally. So from the body and to get out of the body. So this process, what do we need for this process? That's a kind of movement of the body fluid. So we will need the qi, right? That's the qi movement to promote the movement of the urine, which is the urination. So firstly, we're going to talk about the abnormal volume, excess volume. This means that the body releases normally large amounts of urine each day. So this should be much like significantly more than 2,000 milliliter. By the way, sometimes people will ask, we talk about the volume of the urine, 1,000 to 2,000 milliliters per day. Sometimes they will ask, how do you know the volume? Because normally we don't really measure the volume of the urine. But for the disease situation or for a patient, especially for the patients who stay in the wards, especially if they have problem related to the kidney, then in this situation, we actually will ask the patient to measure the urine, and then they will keep a record. That's how we know approximately how much urine they actually have per day. So the excessive volume, when you see the excessive volume, you will see is, although we talk about urine, but here the urine is a kind of body fluid, although this body fluid, this the one we don't use. That's why we need to get them out of the body. But this is a kind of body fluid, which means the urine is influid. So here we mentioned influid. This influid When you see excessive, you got too much in fluids, you need to think about why you will have too much in fluids in the body. Then you can think what can consume, what can reduce the in fluids in the body. That's the opposite part, the yang qi, right? The yang qi can help to reduce the body fluids. The yang qi can consume the yin from the theory. And this yang qi can be the yang qi of your body. It also can be the yang from the pathogen, such as the fire. So if you have fire in the body, or you're attacked by the fire, the pathogen, you're going to have less urine. So if you got excessive urine, that's the opposite side. That's why you will have cold syndrome. It can be the pathogen of coldness. It also can be the yang deficiency of your body results in cold syndrome. So the cold syndrome of yang deficiency, it can be the kidney yang deficiency. Mostly is the kidney yang deficiency. It also can be the spleen yang deficiency. And why we said it's related to the kidney yang deficiency, that's because the kidney in charge of the water metabolism. The kidney relates to the urination closely. And also for the excessive urine, we also can see from the property of the urine. This kind of urine mostly clear. So the color of the urine is clear or lighter. This also indicates the yang deficiency or coldness. Sometimes the patient also presents with other symptoms such as polydipsia, polyphagia, and weight loss. This can happen in patients with diabetes or high blood sugar. So high blood sugars, it can be diabetes or pre-diabetes. For this disease, for diabetes, we write here, it is actually not accurate to write diabetes, the disease name here. For these symptoms, we also need to conclude into yin and yang or different pathogens. So even for diabetes, we're going to locate the cause to organs such as the stomach heat or the deficiency or the kidney yang deficiency in different types of diabetes. So for the excessive urine, you need to understand the yang deficiency, especially the kidney yang deficiency, the coldness, the cold syndrome, the cold pattern can cause the excessive urine. Opposite to the excessive urine is the scanty urine, the scanty volume. This means that we have less urine, the less volume, especially less than 1000 milliliter per day. Why we have less urine? That's the similar explanation to the previous slides. If you have less urine or less body fluid in the body, then you need to think about, do we have enough source to generate into urine? That's due to such as patients suffer from the fire pathogen, the heat syndrome. So the heat, the fire in the body will consume in fluid, which will result in less urine because you don't have enough in fluid in the body. And also sometimes the patient with diarrhea, they also will have less urine. That's because the body fluid goes out of the body from the stool. Patients sweat a lot, or patients with vomiting, they will all affect the body fluids in the body. if you have the less urine, less volume, especially for diarrhea. If a patient suffers from diarrhea and then after the treatment, how do you know the diarrhea is going to be healed or not? Sometimes you can see from the urine. If the patient don't feel like to have a lot of urine, then you can assume that the diarrhea might still be very severe. If the patient start to urinate, you will see that the diarrhea may be relieved or it's recovering. That's something you can see from the urine or the urination to predict or to forecast the prognosis of the certain diseases. The scanty urine, the scanty volume, also can cause by the yang deficiency. That's because the heart yang deficiency, the spleen, the lung, the kidney, these yang deficiency will cause. So in order to get the urine, the body fluids out of the body, the first one, why we don't have enough urine, the first is the body doesn't create or generate enough urine due to the fact that we don't have enough body fluid in the body. The second cause, it might be the situation that we have enough body fluids in the body, but we don't have enough yang qi to push, to move the water out of the body. So in this situation, the patient is in deficiency situation, will present as edema, urine retention, and the other common aspect is the blockage. The blockage, such as the blockage from the stone, the kidney stone, or bladder stone. So the blockage or the injury of the urethra will cause the scanty volume. So these are different factors we need to think about when we see the abnormal volume of the urine. The abnormal frequency. Frequent urination. Frequent urination is which means the patient go to toilet for urination more than usual or more than 5 times, and this can happen during the day or at night, so while they sleep. The frequent urine can divide it into two aspects. One is especially for the associated symptoms. If the frequent urination is associated with the urgent and painful urination, this can be the damp heat, the cause of the damp heat. So that's the urgent urination, they feel urgent. Painful sensation, these frequent urination, urgent urination, and painful sensation, these three symptoms is very typical for inflammation. In Western medicine, the inflammation in acupuncture theories, we always think about the damp heat. It depends on the situation, obviously. We need to see from other symptoms as well, damp heat. So that's the cause for this. So if a patient presents with frequent, urgent, and painful urination, we're going to use the treatment to clear the dampness and reduce the heat in the body. Why the patient can present as scanty urine volumes, this is because of the heat. The heat is a young pathogen. Young pathogen will consume the in fluids. That's why we don't have a lot of the large volume of the urine. So that's the one situation, especially for the acute stage. Patient with a chronic stage or with after long term, the frequent urination, especially the patient presents as frequent urination at night while sleeping. This is mostly related to kidney yang deficiency. So the yang deficiency will cause frequent urination at night. And this mostly happens in senior people, senior patients, or someone after sick for quite a while, so which means they have a weaker body constitution. They will have frequent urination. Frequent urination sometimes is quite common in our clinical practice, especially for inflammations. So that's what they present as for frequent urination. The frequent, urgent, and painful. These three are always together. The urine retention refers to hesitancy in urination and a decrease in the volume. This means the patient has urine, but the urine stay in the body. So mostly how we understand this situation is the first is the blockage. Something obstructs in either in the kidney or in the bladder. So the whole system is blocked. The blockage can be from the stagnant blood, can be from the stones, or from the damp heat. So any kinds of pathogens can result into the blockage. These are the excessive patterns. The retention also can see in deficiency symptoms. The deficiency symptoms is mostly happens in senior patients, chronic conditions, especially with the failure of kidney qi, especially for kidney yang qi. So these are the pathogenesis of these symptoms, and from this pathogenesis, we're going to understand how we are going to treat if a patient presents with urinary retention. How we understand how we're going to treat them. We're going to increase the kidney yang qi for the deficiency. How to increase kidney yang qi? We can either use herbal medicine, acupuncture, or moxibustion, which we are going to study in future. So these are different treatments towards different pathogenesis. If when you diagnose the patient, the retention due to excessive symptoms, so in this situation, you will use different herbs, different acupuncture points, but normally you will not use the moxibustion because it will increase the heat. It might make the situation worse. So that's why we need to understand the pathogenesis. The last aspect is we need to understand abnormal sensation during the urination. Dysuria. Dysuria is the feeling of pain, burning, discomfort upon urination. So it's actually painful urination. This is commonly seen in the blockage. So we don't really use the terms, the medical terms, but we more focus on what is the cause. Because the cause of damp heat can be these two, it also can be other diseases. So from here, we need to understand the damp heat can cause, the blockage can cause, and also the blockage of different pathogens, such as the pathogen of stagnant blood, the phlegm, the kidney stones, or the stones can cause the painful urination. The next one is the dribbling. Dribbling refers to dribbling of small amount urine after urination. In this situation, the patient can present with normal urination, but at the end of urination, the process is not dribbling. This is commonly seen in elders and a patient with a weak body condition, especially for kidney qi. So if the patient, they tell you that when they go to toilet for urination, it takes much longer time. For this situation, we will think about kidney yang qi deficiency. We're going to tonify the kidney. So if you still confused about why we're going to focus on the kidney, you can revise the theories in the Zhangxiang theories. What's the function of the kidney? Then you will understand why for this situation we're going to treat the kidney. Kidney can control the opening and closing of the bladder. That's the theory. Urinary incontinence is a loss of control over the urination. Urine leaks before one can get to the toilet. This mostly happens in severe condition. Patient with severe qi deficiency or kidney deficiency, and also it can happen in severe, such as the patient lost their consciousness. They also will have this situation, especially the pathogens affect the heart, cause the heart mind problem or the heart spirit problem. So for this, we're going to think about the yang deficiency. Why they lost the control? That's because which substance in the body can control something? Control, that's qi. So if we lost the control of the urination, that's because the qi lost the function of confining. That's the confining function of the qi presents in urination. That's why we're going to focus on the treatments to restore the qi. The last symptoms we're going to talk about is nocturnal enuresis. This refers to involuntary urination while asleep after the age of 3. So if the kids below the age of 3, it might be normal, but if the age after the age of 3 we should consider as abnormal for this situation. This is also commonly caused as bedwetting. The cause of this is congenital kidney qi deficiency. The congenital kidney qi deficiency will cause the lack of bladder control. So this is the cause, this is the results. When we introduce these different causes, these are the common causes. To study these causes, to understand the pathogenesis, we need to train the way to analyze the symptoms with associated the other associated symptoms, and then to conclude to a diagnosis. So, although we say here the congenital kidney qi deficiency, we need to see from the other symptoms if the kids presents with the bedwetting, but he also presents with the very red tongue with yellow coating, then you need to think about the diagnosis, is it correct or not? Because it might be from such as damp heat from the liver. This is it's contrary to the qi deficiency, because for patients with qi deficiency, kidney qi deficiency, they will have pale tongue, fatigue. So when you try to diagnose, you need to gather all the information, all the signs and symptoms to help you to diagnose. Then always refers to the textbook or refers to the notes. That's in this situation. If you said that Dr. Hu only tell me that's the congenital kidney deficiency, so the patient must be kidney qi deficiency for this situation. It's not always the situation. The example we show you here just as an example for you to help you to analyze the symptoms. In the clinic, we need to gather other information to confirm your diagnosis. So this is one example. It also can be the other examples, such as from the pathogens, internal evils. So we're going to, when we study the therapeutics, we're going to study in details. So don't only stick to these explanations.